Hey, this is Antonio here with Elite Medical, and today we'll be talking about your medical care, selecting a treating physician, and changing your treating physician. So oftentimes we get questions from clients and potential clients of, how does the process work when they're initially trying to find a provider? Do they have to go to somewhere or someone in particular and they're just confused, or they have a doctor and they want to change, right? And so first and foremost, you as the federal employee have the right to seek the medical provider of your choosing. Okay, let me say that again. You have the right as a federal employee to seek the medical provider of your choosing. Okay. Now, of course, it would be prudent of you to select a provider who is credentialed by the Department of Labor, who understands the process, who understands OWCP and the fecal laws and so forth and so on, because that can only benefit you throughout your claim. There are some instances in where your agency may suggest or recommend that you go to a particular medical provider. And even if you do go to that provider initially, you still have the right to seek a provider of your choosing. Now, what happens is when you are treated by a physician more than twice, that physician becomes your physician of record. And there can only be one physician of record at a time, with OWCP. And so if that treating physician refers you out to a specialist, okay, that's usually acknowledged, that's granted, no problem. You can go see the specialist and get the medical care there. But if you simply just want to change from one office to another, or one provider, or one facility to another, you have to actually go through a process and get the request approved. And so you have to do it in writing. You have to state the reason, provide information of the new provider that you are wishing to go to, and provide that and wait for an approval. Okay. Now, oftentimes we see that approval, but there are times where that approval is not granted, and a lot of potential patients and people we come across, they may want to simply change because they don't feel like they're getting the medical care that they need or deserve at their current facility or with their current provider. And what we see is sometimes that may not be enough reasoning to approve the change or request. Okay, even though we know you feel that way, it may not be enough substantiative evidence. And so which typically we would see some examples would be, say the new provider is in closer proximity to you to you than your old provider. That would be a substantiative reason for change. Or let's just say your old provider, they no longer are treating, or they simply released you and you need a new doctor, right? That's a substantiative reason for change. So you have to have a valid reason. You have to submit an actual approval to change, and it has to be granted by OWCP before you can, begin seeing another physician, or at least before OWCP will pay that medical practice and that treating physician. So I hope this helps. I hope this streamlines the process for you. And if you have any other questions, certainly don't hesitate to reach out.